In this installation of Diseases in Society Lab 207 podcast, we are focusing on why our generation might not live as long as our parents' generation. Today we'll be talking about the American obesity epidemic, but first we need to define what obesity is. According to the American Medical Association, obesity is a disease in which a person has a body mass index of 30 or more. Although this is a general definition, it varies from person to person. For example, athletes may fit the definition of obesity, however their high BMI may be due to muscle mass as opposed to fat.
Nearly 78 million adults and 13 million children in the United States deal with the health and emotional effects of obesity every day.
So what parts of America have the highest obesity rates?
According to the state of obesity, the state with the highest obesity rate is Arkansas, with 35.9% of adult population falling into the obese category. High schoolers in Kentucky have the highest obesity rate in their age group with 18%. For ages 10 to 17, Mississippi has the highest obesity rate of 21.7%.
What about obesity makes it so severe that it is classified as a disease?
According to the CDC, obesity has many negative consequences in terms of one's health. This can include high blood pressure, type 2 diabetes, coronary heart disease, stroke, gallbladder disease, sleep apnea, some cancers, and most devastating, death. Not only can obesity affect your health, but it can also affect your wallet, as you are likely to have more medical costs if you are obese. Obese patients are reported to pay $1,500 more than non-obese patients in medical costs. Overall, an estimated $147 billion was paid in medical costs in 2008 due to complications stemming from obesity.
How does obesity affect North Carolina specifically?
In North Carolina, 10.8% of adults have diabetes and 35.5% have high blood pressure. Even more devastating, an estimated 143,000 people have an obesity-related cancer. In 2030, that number is expected to more than double.
One startling fact about obesity is that it is affecting Americans at younger and younger ages with each passing generation. The percentage of children aged 6 to 11 years in the United States who were obese increased from 7% in 1980 to nearly 18% in 2012. Similarly, the percentage of adolescents aged 12 to 19 years who were obese increased from 5% to nearly 21% over the same period. In 2012, more than one-third of children and adolescents were overweight or obese.
What are some factors that contribute to this?
Having listened to some of the personal experiences from correspondents here in Lab 207, the stress of school seems to be a primary factor in the rise of obesity. With increased schoolwork, college applications, and other academic and extracurricular responsibilities, many students report feeling overwhelmed and stressed.
How does this link to obesity?
Well, data shows that the states who reported the highest stress levels also have high obesity rates. For example, Arizona, ranked the 10th most stressed out state in America, also ranks as the state with the 6th highest childhood obesity rate at 19.8%.
While the immediate response to acute stress can be a temporary loss of appetite, more and more we are coming to recognize that for some people, chronic stress can be tied to an increase in appetite. Stress included weight gain, says Alyssa Epple, PhD and assistant professor in the Department of Psychiatry at the University of California at San Francisco.
To further investigate our theory, we have conducted interviews with current college students.
What year are you in college?
Currently, I am a senior at Hampton University.
In comparison to earlier years of education, would you say that college has cost you more stress? If so, in what ways?
College as a whole is very stressful in terms of time management skills. I have a hard time trying to battle between, okay, what assignment am I going to do next? What should I do first and what to do the next day? And I still have issues with that even as a senior in college. And right now it's very stressful trying to determine, okay, when is an assignment due? When do I start applying for graduate school? And et cetera.
How has your eating patterns changed while in college? What would you say the reason for it is?
My eating habits in college have really changed because I'm really trying to get into this new health kick where I'm trying to, you know, look a certain way, be physically fit, and just have more energy as far as my health and lifestyle. In college, it's kind of hard to maintain a healthy lifestyle while you eat, and sometimes you just worry about, okay, I might need to change my eating habits because I don't want to like gain weight and people call me fat and stuff, so it's like really hard. So yeah.
At what time of the school year would you say you had the least healthiest eating patterns?
So I really don't have a particular time of the year where I have like my least healthiest eating like pattern. I would say that could be during any stressful time in your your school year. Like anytime you feel like you're very stressed or you're just overwhelmed and you have a lot of stuff on your plate, you may have a tendency to pick up an extra piece of food to like to eat because you're just like, okay, how am I going to get this done? I need to do something to distract me. So it's not really a particular time period or situation where I feel like, oh, I got to eat all this food because the final's coming up. I just feel like it's just during any, situation that's stressful.
In what ways do you think college campuses could better help students eat healthier and be more active?
So there are like a few ways that you could probably get a college student to be more active and healthier within their lifestyle. I think like first, like going to the gym, like not by yourself but with friends, because it kind of helps you stay motivated to want to keep working out. Like always work out with a group of friends. Also, as far as eating, try to like go grocery shopping or like jot stuff down in a food journal about like what you're eating and like what you could cut out of your diet and like, try to get advice from people that can kind of motivate you to say, oh, I want to help you lose this weight or help you, stay healthy and active.
Would you say that your eating habits from home remain consistent while in college?
So have my eating habits been staying consistent from college to home? I would say yes and no, because sometimes depending on what my mom or my dad cooks, I feel like I have to eat it, and like I don't want to make them feel bad by not eating it because I want to change my healthy lifestyle. Sometimes it's like very hard to tell people, I really don't eat this anymore, and they're like looking at you like, why don't you eat that anymore? That hasn't stopped you before. So it's kind of like, no, it's not really consistent.
How were your eating habits while you lived at home?
So like I said before, how my eating habits are at home, they're okay. I could be doing a little bit better as far as making healthy food choices. Right now I'm trying to start this pescatarian diet, which is just eating like fish and vegetables. So yeah, hopefully when I get back home I can be able to stay consistent with that diet.
Researchers at Auburn University in Alabama followed 131 students over 4 years of college and found that a whopping 70% of them packed on pounds by graduation, an average of 12 and up to 37 pounds. The overall percentage of students found to be overweight increased from 18% to 31%. They attributed the weight gain to late-night study habits, often fueled by vending machine snacks, fattening choices in college cafeterias, and a lack of activity.
How does the stress and associated weight gain of high school and college affect one's life expectancy?
In a study published in the New England Journal of Medicine, researchers have found that rising children obesity rates will cut average U.S. life expectancy from birth by 2 to 5 years in the coming decades.
What are some things that we can do to stop the onset of obesity in high school and college?
It can be challenging to incorporate a healthy diet and lifestyle while being so immersed in school life, but there are many small changes one can make to dramatically improve his or her health.
These small changes can include meal and snack planning, incentivizing healthy living and eating, desk exercises, taking breaks and jogging in place, limiting fast food to once or twice a week, and walking or biking during shorter commutes instead of driving or riding the bus.
Obesity has the potential to affect us all. It does not discriminate among races or genders. This disease can have devastating long-term effects and may even lower one's life expectancy. Students today are faced with the challenge of learning how to manage a high-stress environment along with maintaining a healthy lifestyle. With the simple changes previously mentioned, students can avoid the effects of obesity and live a more healthy, productive life. Thanks for joining us here at Lab 207. This concludes this installation of the Lab 207 webcast. Thanks for listening.